You're listening to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining. We're going to be speaking with returning guest Dr. William Flood, Chief Medical Officer for Eviti at NantHealth. He's returning to talk about the newly launched Eviti Connect. Welcome back, Dr. Flood. Thanks for joining again.
Thank you.
Give our listeners a bit of your professional background for those who may not be familiar with you as a contributor.
Thank you, Neil. I am a medical oncologist, and I have been part of the Eviti product now for 16 years.
And your role there at NantHealth concerning the Eviti product?
Well, NantHealth as a whole, our goal is to provide companies with actionable data and actual interpretation of their data. Mm-hmm. And so the Eviti product historically has done that in cancer care. We review treatment plans for patients who are undergoing systemic therapy or radiation therapy with cancer and provide feedback to both the providers and the payers about how it fits current standards of care and any specifics to the payer's insurance plan language or policies and the like. By doing that, we've been providing value in this space for 10 years.
Now, oncology is a huge space. Does Eviti Connect run the gamut of autoimmune diseases?
Yes. We have this 10-year track record of experience in oncology, and we think it's really directly applicable to autoimmune disease. Mm-hmm. You talked about the immenseness of cancer. Well, it is an immense disease. It costs roughly $150 billion to treat patients with cancer mm-hmm. Annually. At least that's based on some data from a few years back. Conversely, autoimmune disease costs about $100 billion annually to treat it within the United States. There are also many more patients who have been diagnosed with autoimmune disease at any given time in the United States. The current number of patients felt to be affected by some autoimmune disease or another is 50 million in the United States. That's dramatically smaller than the number of current patients with or who have survived cancer.
How many practices would you say are taking advantage of Eviti Connect?
Well, we know that thousands of physicians' offices have used Eviti Connect to connect to their payer around patients with cancer. And so with autoimmune, our autoimmune tool being new, we're going to be rolling it out in an iterative fashion. And we don't focus on the practice so much as we focus on the payer. Our model is to work with any physician's practice who has a member of one of our payers in their care. So we don't depend on having a relationship directly to the doctor's office. That would limit our ability to serve every patient or every payer as possible.
Now, there are many autoimmune diseases. I mean, it's a huge space, as you pointed out, as well as the cancer space. Speak to specifically how the physicians and the payers use this technology.
So again, if we compare it to our cancer experience, the central core or hub for how our Eviti Connect tool works in oncology is a library. And that library is built around evidence-based and endorsed treatments in the treatment of cancer based on the literature and our peers across the country, in some cases internationally. So we're taking that same approach in that we are casting a wide net to look at all the diseases that are currently under that autoimmune umbrella, roughly 80 diseases per the National Institutes of Health. Our methods, have been tested and vetted and improved over time because of our oncology experience, and we're URAC accredited. And so we're taking that same experience and rigor and just applying it to a new disease space.
So basically matching the patient to the treatment that is best for them from the patient outcome standpoint and the payer's financial standpoint as well.
Well, you jumped ahead a little bit. Right now, most offices and most payers pay for service, what's called a fee-for-service or discounted fee-for-service model. the ultimate application is to really use more data to identify treatments that we think are truly the most valuable in terms of delivering the best outcome, the least toxicities, and lesser expense. And that's the true goal of the whole value-based care model that is being promoted across the United States. I don't think we're there yet, but that's okay because our technology already empowers both simple fee-for-service cancer care and value-based cancer care. So since we're taking that same technology and the learnings from cancer and applying them to autoimmune disease, I think we'll be able to deliver both appropriate fee-for-service authorization and understanding, but then move towards a value-based model with our payers, as soon as possible.
Was there anything that you'd like to add, William?
We are just very excited to offer our services and our technology in a new disease to help more people.
Well, give us a website where our listeners can learn more about the Eviti Connect technology.
I'd refer you to our mothership website for NantHealth, which is NantHealth, N as in Nancy, A-N as in Nancy T, health, all one word, .com. And there you can find our descriptions of our Eviti Connect product for oncology, some discussion about our new product in autoimmune disease, but also some of the other solutions that NantHealth brings to the table to provide that actionable data and to make data actionable at scale.
Always a pleasure speaking with you. I'm hoping that you'll come back again and speak with us as things progress.
Thank you. We would love to come back at some point with a progress report about how we're doing.
Absolutely.
Most importantly, though, thank you, Neil, for this opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. William Flood, Chief Medical Officer at Eviti at NantHealth. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.